My presentation is going to be just a little bit different. It's not sharing any research, but I'm going to share a project I've been working on for about a year and a half in Canada, which is really aimed at helping pharmacists learn more about tobacco harm reduction and how that could be applied in a clinical pharmacy setting. So just to back up and provide a little bit of background, pharmacists in Canada have one of the broadest scopes of practice in the world as it pertains to pharmacy practice. So this scope of practice includes things like the authorization to administer drugs by injection, the ability to renew or adapt prescriptions, and then also additional prescribing authorization. So that's for the purposes of initiating drug therapy and or to manage ongoing drug therapy. And so as that would pertain to smoking cessation, pharmacists in Canada take a leading role when it comes to often managing a patient's quit attempt, prescribing drug therapy such as varenicline or bupropion. Now, despite this leading role, when pharmacists in Canada were surveyed prior to starting this project, only 4 in 10 Canadian pharmacists were aware of the concept of tobacco harm reduction. Only 8% chose switch to e-cigarettes as an effective strategy to reduce smoking rates. And 91% indicated that they would like to learn more about tobacco harm reduction. So without the knowledge of tobacco harm reduction, Canadian pharmacists continue to really have nothing to offer to patients that are just unable or unwilling to quit. And being a pharmacist myself, we all see many of those patients each day. And so this is really likely what was behind this 91% wanting to learn more, because for many years, we've just had nothing to offer these patients. So in the start of 2022, I started to develop a comprehensive professional development program, which was really aimed at reviewing all aspects of smoking cessation, kind of all the conventional ways smoking cessation could be approached, but also the tobacco harm reduction approach to that. And so it really was aimed at the goal of just increasing pharmacists' knowledge on tobacco harm reduction. So in the start of 2022, did kind of all the groundwork, reviewed all the evidence, and then started to put together this professional development program, which ended up being about 1.25 hours in length. So it's about 75 minutes. And what we review in this time frame with pharmacists is harms associated with combustible tobacco use, because we're going to be talking about reduced risk products and how those harms relate. We kind of walk through, all the specifics on harms associated with combustible tobacco. Goals of therapy for patients that use tobacco. It seems obvious, but once you start talking about harm reduction, it's a little more nuanced. And so we also look at how that looks and how harm reduction could fit in that. We still review the conventional treatments because it's still, of course, important to offer patients an option if they are at the stage where they're willing to attempt to quit using tobacco, using one of our kind of tried and trusted first-line options. We know they have limitations, but we still do have some patients that can be successful quitting that way. And then we kind of get into the stuff that tends to be very new. So usually when I start presenting, I kind of poll the audience, and usually there's very little knowledge other than what pharmacists would hear in the media about e-cigarettes. So typically they're coming in with a very negative view on e-cigarettes because, of course, most of the media coverage tends to be negative. So we talk about the emerging trends in nicotine use and really what these reduced risk products are. So what are e-cigarettes? What are heated tobacco products? What is snus? What are nicotine pouches? And what are their associated risks? Of course, based on the evidence that we have, we know that there is reduced risk comparatively. And so we kind of bridge that early discussion about the risks of combustible tobacco with all that we know about the risks with these reduced risk products. And then the end is really to try to pull it all together so that the pharmacists could have some takeaways to take back to their own practices to actually start to engage patients with on this topic. and so how a pharmacist would then apply this in an actual Canadian pharmacist practice. So it was nationally accredited in June of 2022, so that's a typo, but so we've been offering it for just over a year now. So national accreditation in Canada is something that we have for professional development programs for pharmacists, for physicians, and other health professionals. And really it's aimed at just making sure that any education directed at practitioners is evidence-based and really free of any commercial bias. And so as part of getting accredited, it was required to be completely evidence-based, no commercial bias, but also required review from 2 independent pharmacists. So 2 pharmacists that would be subject matter experts in this area, work in it, maybe more than the average pharmacist would, and have a lot of more knowledge about kind of the evidence around all of this stuff. And so once it was prepared, I submitted it to those 2 pharmacists, and they make, a few suggestions for improvement, but they basically okayed it, and we were able to submit it to our national accrediting body. And then they independently review it internally to ensure that they're kind of satisfied that it meets the requirements of what could be accredited in Canada. And we were fortunate that it was granted that approval in June of 2022. And so since that date, I've delivered the program to over 1,000 Canadian pharmacists. So have ran a number of different events, both in person and many virtually as well. And I submitted this a few months ago now, so actually confident that by the end of the year it'll be about 2,000 total. So reaching 2,000 Canadian pharmacists to kind of help spread this message. One of the requirements with accreditation is we have to formally evaluate it each time as well, and then submit that to our accrediting body. And so we ask a number of different evaluating questions, but here are the 3 that I think are probably most relevant. And so the first one was the presentation presented without any bias? Because of course people come into this very skeptical because of what they know and have heard from the media, and pleased to share that 91.9% of participants felt the content was presented free of bias. So most people are comfortable that it's something that is evidence-based and not biased in any way. 92.7% believe that this would be helpful to their own individual pharmacy practices. And then 94.8% stated that overall I was satisfied with this presentation. And really, when it boils down to it, kind of where I always end up, so I thought I would use this for my last slide today too, is that the buzzword right now in Canadian pharmacy practice is patient-centered care, really trying to make sure that the patient is the root of all decision making. And that really, to me, is where tobacco harm reduction couldn't fit better with that approach. Because as mentioned, we all have many, many different patients in our practices that are just struggling to quit, or they're just not interested in quitting, right? There's a number of different things that occur. But this offers us finally something to help these people. So I always use this ladder analogy, and our goal as a pharmacist is to get them, always to the bottom of the ladder when we think of risk. So the top of the ladder would be, conventional cigarettes, and the bottom of the ladder would be absolutely nothing, using absolutely no form of any product. But we know that that is often just not possible for so many people. Maybe they just don't even want to do that, right? And so patient-centered care is just about helping them get down the ladder in whatever way that we can. So that could be, reducing their risk by switching to e-cigarettes. It could be reducing their risk by switching to heated tobacco products, or even snus or nicotine pouches, of course. And that's basically what I have presented kind of for the last year and a half, and we're really happy with kind of the engagement that we've got, and are hoping that Canadian patients are benefiting from that. Thank you.